The International Centre for Eyecare Education, or ICEE as it's known, is a global organisation focused on sustainable solutions for eye care. More than 300 million people are avoidably blind or vision impaired and need access to an eye examination or a pair of glasses in developing communities all around the world. ICEE is working to provide the right solutions. In 10 years, ICEE has worked in more than 40 countries. Right now, ICEE is working in remote communities in Australia through the Aboriginal Health and Medical Research Council, the West Pacific and Southeast Asia. In each location, ICEE works with the community, government and other non-government organisations to develop eye care that can be sustained by the community in the future. In Sri Lanka, ICEE is working towards a program to implement vision centres to provide eye care to its population of 19 million.
How many hospitals in Kegol district provide eye health services?
Only one, that is at the centre, it's Teaching Hospital Kegol.
So do the people in the rural areas of Kegol have easy access to these eye services?
No, that's not possible. It's very difficult for them to come to the Teaching Hospital Kegol.
Sri Lanka has a very elderly population. So I think we have more than 100
Here in Udagoda?
per month.
100 per month, and that's for vision?
Yes.
In the morning it's around about 500. Morning session is around about 500.
Oh, 500.
And then of course evening, we have around about 350.
And
That is that amount. So it's around about 850. Sort of 850 to 900.
That's a lot.
This becomes a sort of main hospital for these people around here.
Right, okay.
Right? Yeah.
Maybe they have a problem that doesn't require an ophthalmologist,
That's
but a
right.
medical officer. Is there a high need?
There is a high need. We need a vision care center.
If we have a vision center here, we can get more patients, we can catch more patients.
About 10% of this population is elderly. So definitely there will be people with eye problems. But I don't know whether the private sector will provide spectacles for the people, but in the government sector it's hardly any. There's no proper organized services for spectacles.
As we have identified in our national program, refractive error is one of the major causes for blindness in this country. We need to train and develop the capacities of the healthcare workers to tackle with this problem. So I am sure that the ICEE, who has come forward to implement the program to address these two issues, to train the primary healthcare staff as well as the healthcare workers.
My life is very better with glasses.
I'm always wearing these specs because when I'm not using this one, I'll get headache.
I couldn't read well. I went to a doctor. My life is now better now.
Most of the time, my job is I'm doing driving and bird watching, so I have to have a very good eyesight. So it's helped me a lot.
I can see. I'm very happy.
When I read Quran, I have to wear the glass and I read Quran. And I have fixed 2 lenses in my eye. Now, okay, I am a better life here.
For so many people in Africa, there is no access to an eye examination and a pair of glasses. This is particularly true for children. ICEE is addressing the need through its Child Eye Care program, which gives children the chance to be screened for refractive errors and, where needed, to receive a pair of glasses. The World Health Organization says that 75% of the world's blindness is preventable.
This project is about getting each and every child in this province an eye test, and if they need spectacles, it will be on their face. There shouldn't be any child in a classroom in KZN that cannot see, and it's due to the need for spectacles. In terms of training, we actually recruited members of the community that were volunteering previously, so it's job creation and skills development.
What I'd like you to do for me is show me where these lines are facing. If you see that they're facing this way, do this. Which way is this facing?
There's 2.5 million children in South Africa. Now, a study was conducted previously in 2003, and it found that of the children that had reduced vision, 63% of them actually had refractive error. And the solution for refractive error is one of the cheapest solutions. It's a pair of spectacles.
To create sustainable eye care models, like the Child Eye Care program, ICEE requires continued support. ICEE, like other NGOs, is working to find the right solutions to meet the needs of every country and each community.